Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 5-month-old hound puppy presenting for orthopedic screening. You detect some hip laxity on physical exam and question elbow pain, so you elect to perform multiple radiographs of the front and hind limbs to get an overall idea of what could be going on with this puppy. I'm going to focus today on the left antebrachium. I'm going to give you a minute to look first at the elbow, and we're going to move down the limb to take a moment to look at the antebrachium and carpus. Let's go back to the elbow as we start our discussion. Last week we talked about how with elbows it can be really tricky to look for medial coronoid disease, and I showed you a CT scan where the medial coronoid is that beak-like projection that hugs the proximal ulna. When I'm looking for medial coronoid on the radiographs, I trace the cranial margin of the ulna, and often, but not always, with a really nice quality radiograph, we can actually see that beak-like projection that's the medial coronoid process. So here's an example where we see it well radiographically. I also, when I'm doing elbows, look at congruity, and I see the radiographic joint space as being relatively uniform here. We assess this part of the elbow, which is the ancanal process of the ulna. And you'll recall that in the neutral view, the distal humerus is superimposed. I'm going to quickly pop to a flexed view just to remind ourselves that when we flex the elbow, the ancanal process is less obstructed, as that medial epicondyle of the humerus and in a juvenile, the associated physes are out of the way. This portion of the ulna fuses with the rest of the bone at about 6 months of age, so to see this nice and solid in a 5-month puppy is a good normal finding. Let's go down to look at the antebrachium and the edge of the carpus. We talked about how alignment and cartilage go together when we're looking at elbows. For long bones of juveniles, actually A, B, and C, alignment, bone, and cartilage all end up coming together because we're looking at physes. So here we have the distal radial and distal ulnar physis of this patient. The physis is radiolucent because it's made of cartilage. The metaphyseal side of the physis is the side towards the center of the bone, and it's often a little bit sclerotic, and that's normal because this is an active area of mineralization within those ossification zones at the physis. When I look at the physis of the distal ulna, I do expect to have normally this V shape. This is one of the few physes that isn't essentially a flat or parallel shape. So this shape is normal, but when I assess the opacity, maybe you can see that within this metaphyseal sclerosis, there's in fact a zone that's much more radiolucent. I'm going to put some arrows on it for us to look at. Not only is this area in the metaphysis of the left distal ulna a little more radiolucent, that has a bit of a sclerotic margin, and you can see it even starts to extend up into the diaphysis. This finding is termed a flame sign, actually because it kind of has the shape of a flame. I'm going to remove the arrows so we can see it unobstructed. This radiographic finding is consistent with a retained cartilage core. If you think about what retained cartilage core means, it means that from that ossification center at the physis, instead of being mineralized, the cartilage is retained, so it doesn't undergo mineralization. That explains why it's more radiolucent, because it hasn't undergone mineral to give it that normal bone opacity that we would expect. If I continue to look around this area, I notice another finding here. As I'm doing my ABCDs, you know I like to trace the periosteal, endosteal, and medullary portions of each bone. You can see that there's a little bit of a periosteal reaction here. It's fairly smooth, although it does lift from the surface of the bone. This is actually a really common finding in the metaphyseal region of rapidly growing dogs, and it relates to the active ossification that's happening. One of the terms that has been applied to this is the term cutback zone. So this is probably a normal finding, and certainly by how smooth it is, it has a non-aggressive appearance. So to conclude about this case, from the perspective of the elbow, I don't have any abnormal radiographic findings. Of course, we know in a dog this young, that does not fully exclude the possibility of elbow dysplasia down the road. However, we do have some findings in the distal ulna, in particular a flame sign or retained cartilage core. In this patient, I'm going to take a second to show you that it's actually bilateral. Here's the right side. As you look at that distal physis, can you appreciate that sclerotic rim in an almost flame-like shape, and within it, a slightly more lucent zone? Retained cartilage cores, or failure of endochondral ossification, are most often noted at the distal ulna. They can be incidental, or they can contribute, for example, to angular limb deformity or other concurrent orthopedic disease, especially if they affect the long bone growth. Correlation with orthopedic examination would be necessary, and occasionally it's recommended to either recheck the patient radiographically or clinically over time to ensure that this does not become a problem as the animal matures. Thanks for listening. Be sure to review the full report associated with this case, and remember, it's your case, so please post your questions on social media.